Joint Exhibit 4.
Identify what it was labeled.
You were previously shown this. Let's see if I can zoom out. Okay, here we go.
It'll do it for you if you just hold it still for a second.
Got it. And do you see at 2015 on the 5th of December, you noted that he was on 100% oxygen. Is that correct?
That's correct.
All right. Now, what's that going to do to a person once they get taken off of 100% oxygen and the room only has 20 when you need 100 to breathe?
Objection.
Sustained.
When you were asked on direct examination about, or you spoke of the oxygen levels, why did you bring that up?
That is a good indicator of how sick and injured a person's lungs are.
Is it an indicator of how long they may breathe after being taken off the ventilator?
Objection, Your Honor.
Sustained.
Based on your training and experience and what you've seen during palliative extubations, is it an indicator of how long a person will be able to breathe for once taken off the ventilator?
Objection, Your Honor. He doesn't have this knowledge.
Sustained.
Now, sir, you mentioned, well, the prosecutor had asked you in reference to the order for the fentanyl. He mentioned to you, do you recall that your testimony that it was a verbal order?
It was a verbal order.
Okay, I'm showing you Joint Exhibit 4, page 168 through 169. Do you see that, sir?
Yes.
And do you see the patient name there as Danny Millette?
Yes.
And I'm showing you on the bottom an action time at 21:23 on the 5th. That's at the time of the ordering of these meds, correct?
Yes.
And it's specifically the fentanyl, the 100 microgram, I'm sorry, the 1,000 micrograms?
Yes.
Do you see what it says here?
It says entered and electronically signed by Dr. William Husel.
So does that indicate to you that it was a written order by Dr. Husel?
Yes.
And I guess you also just entered one in verbally, is that correct? You have also entered one in, correct?
Yes.
Is that maybe where the confusion lies?
It could be.
Okay. Now I want to talk to you about when you spoke with Danny Millette's family. You testified under direct examination that, and I wrote this down, discussed all of the things we were going to do. Do you recall saying that under direct examination?
I recall that.
Tell us about all of the things that you discussed.
Yeah. So on top of the prognosis with him that we detailed earlier, we talked about how we're going to turn off the IV pumps, which contain the vasopressors. We talked about how we were going to discontinue the ventilatory tube. We were going to take out the endotracheal tube, put a little bit of nasal cannula on him if he needed it, and we were going to give him pain medication, that would help him be comfortable and pass naturally as a result of his underlying illness.
Did you discuss with the family the potential side effects of the medication?
They were discussed.
Okay. And did you feel that the family, did you feel that the family was well informed by both you and Dr. Husel?
Yes.
Okay. And that included being well informed of the potential side effects of fentanyl?
I think so, yes.
Now, I'd like to move to Mr. Allen. Oh, before I do,
Okay.
Mr. Maletti was on 3 vasopressors, correct?
Yes.
And he was receiving the maximum dose of those vasopressors, correct?
In my best recollection, it was very high, yes.
And despite being on 100% oxygen and 3 vasopressors, he was still actively dying on this life support.
Yes.
You told the jury during direct examination that vasopressors act very quickly. Is that correct?
Yes.
Okay. How quickly, in your training and experience, do you see when you turn off vasopressors that they stop working?
Objection, Your Honor.
I'll permit the question in that format. In your observations
Yeah.
as a nurse, that's what he wants to know.
About 1 minute, 30 seconds to 1 minute.
So in 30 seconds to 1 minute, the jet fuel that's keeping him alive is turned off. Is that correct?
Well, it's turned off and then it begins to lose its effectiveness in about 30 seconds to 1 minute.
Now, let's discuss Mr. Allen.
Okay.
You discussed on direct examination, again, that this was also a very sick man.
Yes.
He had COPD,
Correct.
and that's, that affects the lungs, correct?
Yeah. Yes.
And what does COPD stand for?
Chronic obstructive pulmonary disorder, maybe? I'm basically, it's an issue of the lungs, and it can be secondary to smoking or just the natural aging process as we get older.
Okay, and Mr. Allen was also on vasopressors,
That is correct.
and he also suffered from coronary artery disease.
Yes.
So that's, his lungs are not well, so is his heart. Is that correct?
Yes.
Now, you mentioned that Mr. Allen was I guess in your direct testimony, you mentioned that Mr. Allen was at the ICU and then he would return to the floor. Do you recall that?
Yes.
And then you also testified that while on the floor, they had trouble reaching the doctor. Do you remember that testimony direct?
Yes.
Okay. And that he was paged multiple times?
Yes.
No objections? Okay. I'm showing you Joint Exhibit 8, page, it looks like 846.
I see that.
Okay. Now, you mentioned that Dr. Husel is always available, or very available.
Yes, he would freely walk around the unit and be available to us,
Okay.
the nurses.
And in this note that you testified under direct, you see the nursing note, I have paged Dr. Mangan at least 10 times and he has not called me back. Operator paged him and operator called me back and said Dr. Mangan hung up and hasn't answered.
Yes.
Okay, and then further down on the note, it says, Dr. Mangan called back after several pages, and this nurse reviewed vitals and everything that has went on over the last few hours, notified that son John would like to speak with him. Physician will try and call, but it will be a few hours. Notified of blood pressure now, and the ICU orders need to be discontinued and monitors needed. Do you see that?
I do.
Okay. It was at this point, after not receiving the proper care, that made Mr. Allen return back to the ICU, right?
Yes.
So basically, Mr. Allen had a procedure?
Twice.
Okay. And after the procedure, he was doing okay in the ICU?
He was doing okay enough to be transferred out.
They transferred him out, and his blood pressure dropped,
Yes,
and they couldn't get a hold of the doctor.
that's correct.
And when they did get a hold of the doctor, he gave him some salt water and thought his pharmacology was probably as a result of the surgery.
Yes,
Okay. And then he ultimately ended up having a cardiac arrest in the morning.
yeah, he died.
Oh, I mean in the ICU, yes, in the ICU that morning, correct?
Yes,
And it was later when you came on the night shift and had to take care of him. Is that correct?
yes,
Now, you mentioned that this gentleman was beyond sick and he was coughing up blood. Do you recall that?
and it led to aspiration pneumonia, yes.
Okay. And you also testified that his vent settings required more support.
Yeah, he had what we call an ARDS ventilator setting.
What does that mean to us lay folks?
Acute respiratory distress syndrome. So, and I would have known this at the
Okay,
time.
answer
Yeah.
the question.
Sorry, sir.
Okay.
We've been through this once.
Sure, I was just,
You're just repeating it. I understand.
I was going to say I was just transitioning, but
This is attorney humor, ladies and gentlemen of the jury.
having said that, you mentioned, well, Mr. Allen was also on 100% oxygen, correct?
Yes,
And also on vasopressors, correct?
yes,
Now, you were asked about paralytics at this point. Mr. Allen was not on any paralytics, correct?
nothing that on my, no, he was not on a continuous infusion of paralytic.
In fact, you didn't see anything in the record, or you, during your care, never gave him any paralytics.
To my knowledge, no.
Okay. And you said that when you were approached, that you were sitting at the nurse's station, and the family approached you.
Yes,
And it was, when the family approached you, it was with the intent to withdraw care, is that correct?
yes, that's what I recall.
And it was at that point that that's not something you could do. You needed to call Dr. Husel to hear the family express their wishes, correct?
Yeah, I could not, it's out of my scope of practice to make that change, so I called the physician to the bedside.
And it is at this time that you also discussed the withdrawal of care, including the palliative withdrawal, correct?
Yes,
And you testified on direct that the patient was not stable, correct?
correct.
Okay. And you didn't discuss on direct examination, let's see. And you didn't discuss that conversation with the parent, with the family, excuse me, of Mr. Allen. I'd like to get into that a little bit. Was everything discussed with Mr. Allen's family?
Yes,
And including the potential side effects of the fentanyl?
yeah, yes,
And was it your belief that they had all the information they needed?
yes,
And if Dr. Husel had not given all of the information needed,
Objection, Your Honor.
would you have,
Sustained.
okay? Is it your custom and practice to ensure, whenever you're doing a palliative withdrawal, that the family has all the information they need?
yes,
And did you feel, in Mr. Allen's case, that they had all the information?
I do.
Now, you had noted that, and you're going to have to forgive me, sometimes I can't even read my own notes. It says, withdrawing and grimacing. Okay. And do you recognize grimacing and withdrawing as a symptom of pain?
Yes.
Okay. And you, however, it was pointed out that there were no, what was the pain noted for Mr. Allen?
I believe it was noted as a 0.
Okay. And is that because things move quickly in the ICU?
Yes.
And you sometimes
Okay,
make
hold on,
errors.
I'm lost here. You gave it a 0 because things move quickly in the ICU. Is that how I understood your testimony?
Oh, no, I gave it a 0 because at the time of that particular assessment, I did not appreciate the presence of pain.
Okay.
Let me clarify. I think I asked it poorly, Judge. So if things are happening quickly in the ICU, do you always have time to chart right then and there?
I do not.
And is it fair to say that while you may try your best, sometimes the records don't give the full picture of what's going on?
Yes.
And in this situation, do you think that's the case with Mr. Allen?
I do.
All right, now I'd like to move to Mr. Timmons. Now, Mr. Timmons, as we've already covered, was an overdose patient.
He was a patient who presented secondary to an overdose, yes.
And he, of course, had heart issues.
Yes.
And rather than go over all of his medical issues, fair to say he was extremely sick.
Yes.
And when you arrived, you said that you saw the crash cart outside of his room.
That's correct.
And before you can get a complete update as to what was going on in his condition, his blood pressure started dropping into the 60s.
That's correct.
Now, it's at that time that in an emergency situation, you summoned Dr. Husel.
I told somebody to get him, yes.
Okay. Well, you saw him. You got
Yeah,
somebody to get him.
yeah.
Okay, so he comes running in, right?
Yes.
And when he gets there, Mr. Timmons is actively dying, correct?
Yes.
And he doesn't order 1,000 mics of fentanyl and say, all right, let's just end this right now, right?
No, that didn't happen.
In fact, tell the ladies and gentlemen of the jury, well, you kind of went into some of it during your direct, and I don't want to have to repeat all of that, but there were multiple life-saving measures employed at this time, right?
Yes.
In fact, one could classify it as numerous.
I would agree to that.
Would you agree that Dr. Husel, in his interventions here, did everything he possibly could to save Mr. Timmons' life at this point?
Yes.
Your Honor.
Okay, sustained. Ladies and gentlemen, disregard the last answer and question.
Okay. He ordered sodium bicarbonate, correct?
Yes.
To correct the acidosis.
Yes.
He ordered glucose, correct?
Yes.
He ordered calcium to increase his blood pressure.
And to stabilize the cardiac membrane, yes.
He then ordered epinephrine, which is a vasopressor, correct?
Yes.
To increase his blood pressure.
And help the heart pump, yes.
He ordered hydrocortisone to increase the blood pressure, basically to help the vasopressors perform better.
Yes.
He ordered vancomycin.
Vancomycin,
Yes. A second antibiotic to help fight infections.
yes.
Meropenem, a third antibiotic to address the infection.
Meropenem, yes.
Yes. Then he ordered norepinephrine
Yeah, that's another name for Levophed, yes.
Okay, and that's also to keep the heart beating and increase his blood pressure.
Yes,
He then ordered insulin.
yes,
He then ordered another dose of calcium. Another sodium bicarbonate.
correct.
And then 1 hour before withdrawing care, he then maxed out the vasopressors.
That's correct.
Have you ever been in a situation where a patient was dying like that, actively dying at such a high rate of, at such a high rate of speed where you had to institute so many life-saving measures prior to Mr. Timmons?
Yes,
Okay. And would you say this was right up there with that?
what do you mean by that? Right up there.
Sustained.
I'll withdraw the question. Now, you testified that the brother, Mr. Timmons' brother, was it Lynn?
Yes,
Okay. Lynn had approached you and told you, it looks like we're going to be able to get through the night, correct?
that's what he said.
And what exactly did you say in response to that?
I said, I don't even think about it that way. I can't say that. I'm trying to get through the next 30 minutes to 1 hour.
Did you at that time instruct him not to leave the hospital?
Yes,
Did he leave?
yes.
And then how long before you felt you had to call him back?
Shortly after the second time that the patient kind of had a similar presentation to the beginning.
And after going up on the vasopressors, and when he came back, did you give him an update as to what was going on?
Yes,
And as the nurse addressing a patient, who has more contact with the patient? Is it the nurse or the doctor?
I mean, I deal with the patient more than the doctor.
And who has more contact with the patient's
Well,
family?
hold on. Your question was with the family? He said the patient.
I'm asking both.
Okay, well, that isn't the way it come across to me, so let's rephrase it.
Sure. Let me rephrase it. Who has more contact with the patient? The nurse or the doctor?
Nurses,
Who has more contact with the patient's family? The nurse or the doctor?
nurses.
Okay. And when he came back, when Lynn came back, you gave him all of the information that I guess you updated him with the care?
Yes,
And what did he say to you in response after giving him an update?
it is then that he made the decision that he wanted to withdraw care. He said that his brother wouldn't want to live this way, to take all the SHIT away, and that's whenever I went and got Dr. Husel.
Okay. And it's at this time that Dr. Husel came and you guys discussed the palliative withdrawal?
With the patient, yes. Or with the patient's family, I'm sorry, yes.
Brother, right?
Yes.
And did you have a thorough discussion with the brother?
I believe so, yes.
Was he advised of the potential side effects of fentanyl?
Not specifically fentanyl, just he was advised of the side effects of the pain medication we were going to give.
Okay. And that would include respiratory depression, potential respiratory depression?
Yes,
Okay. So we're clear on we've been hearing a lot of terminology being thrown about as it relates to respiratory. Tell the ladies and gentlemen of the jury what respiratory distress means.
yeah. To me, respiratory distress would mean that the patient is actively fighting to breathe, fighting to move air in and out of their lungs. It's usually it's something that you see. It's something that you can visually see where they're sort of sometimes tripoded over, huffing and puffing, kind of the muscles in their neck and the muscles in their sides are kind of working hard. It's an exhausting process it could be an exhausting process for the patient to remain in respiratory distress.
Now, tell the ladies and gentlemen of the jury what respiratory depression means.
Yeah, respiratory depression would be a reduction in the frequency in which you breathe.
And this is based upon your experiences and your dealings.
Yes.
I'll preface it, Judge, that way. So based on your experience as a ICU nurse, sometimes the opioids are given to address the respiratory distress.
Yes.
Okay. And that is accomplished by respiratory depression sometimes, correct?
Yes.
Okay. And then there's respiratory arrest. Tell us what that means.
In my experience, that is the complete cessation, the complete inability to breathe. You can't move air in, which leads to a heart attack, and you die.
Okay. So those are all three different things, correct?
To me, yes.
Okay. Now, you stated that after extubating Mr. Timmons, that at some point the brother, Lynn, came running. Is that correct?
Yes.
And what exactly did he say?
He's in pain. He's in pain. Somebody come. He's in pain.
Now, I wrote down that you said, help, help, somebody do something. Did he say that?
He said, help, he's in pain, somebody do something.
And you testified that he was gray and blue?
I guess I'll just say discolored, just because that's subjective.
Okay. And are you familiar with the phrase bad death?
Yes.
And is that what you believe you were seeing with Mr. Timmons?
Sustained. Ladies and gentlemen, disregard the question and the answer.
What is a bad death, sir?
Objection, Your Honor.
Sustained.
Based on your training and experience.
Objection, Your Honor.
Sustained. This is our discussion the other day.
Okay, I'll move on. Now, after this is when Dr. Husel ordered more pain meds, correct?
After the brother came out of the room.
And
Yes.
this was to address the symptoms that Mr. Timmons was experiencing at that point in time, correct?
The second dose, yes.
Okay. And that is when you needed the assistance from other nurses?
There were other nurses helping, but I was using their assistance far before that.
And after getting all of this medication from the Pyxis machine, you felt it was prudent to, at this point, call the pharmacy to let them know what was going on, correct?
I called the pharmacist, yes.
And you testified in direct that you spoke with Talon Schroyer,
Yes,
and you're familiar with Talon Schroyer's voice?
yes.
Okay. And you testified in direct that he brought up Mr. Timmons' chart at the time and saw the meds that he was being given?
We were simultaneously looking at the MAR.
And it is at this time that you told Mr. Talon Schroyer the fact that Mr. Timmons had a history with a drug history, correct?
I said he had a drug tolerance.
And speaking of tolerance, you're aware that Mr. Timmons was given 14,000 micrograms just a few hours earlier for that surgery, correct? Or a day before?
I'm aware that he received 14,000 micrograms of fentanyl.
And that's not including the 25 microgram drip that you mentioned during direct examination?
That is my understanding,
And
yes.
that's also not including the 175 microgram drip that you discussed in direct examination, correct?
Yeah, yes.
But while pointing out those two, do you recall testifying at all on direct examination about the 14,000?
I'm not sure I was asked that.
Okay. You don't recall that though, right?
You've asked it twice now.
Again, what you were seeing by Mr. Timmons appeared to you, based on your training and experience, to be painful, correct?
Yes.
And Miss Emma Young had marked it at 0, correct, the pain score?
I testified to that, yeah.
And again, this is another example of, would you agree that this is another example of the records not telling the true and accurate picture, correct?
Wait a minute. Let's go sidebar. I haven't done it all day, guys. I'm trying to be better. We can get there. Okay. I heard that. Hi, guys. We gotta let the court reporter get caught up to us. She has to get caught up to us. You guys can't hear me? Whoa. Damn. Can you hear me now? Okay. We have to wait for the court reporter to catch up to us. Okay, you ready there, Madam Court Reporter?
Yes, sir.
Mr. Baez.
Mr. Deemer, I think my last question to you was, and this is another example where the records don't always tell the complete and total picture, right?
Yes.
And in fact, are you familiar with the expression, there's nothing like being at bedside?
Yes.
Do you agree with that statement?
100%.
In fact, nowhere in the records does it say that that Mr. Timmons was foaming, correct?
That's correct.
And nowhere in the records does it say that he was having these agonal breathing, correct?
I don't believe so, no.
And nowhere in the records does it say that he was turning gray or blue.
No, it doesn't.
And just so I'm clear, whenever you are doing a palliative withdrawal, some of the things that you look for or you're concerned about based on your training experiences, one is pain, right?
Yes.
The other one is suffering, correct?
Yes.
And that could be the patient suffering or the family suffering as they're witnessing their loved one die.
Yes.
And then the other one is, of course, respiratory distress.
Yes.
Now, that's not an all-inclusive list, right?
It's not.
Okay. Now, like to show you the medication order set that's been shown in this case a couple of times, and that's Defendant's Exhibit MCD 16. Do you see that?
I see this.
Okay. And it's specifically for palliative withdrawals?
Yes.
Okay. And then this one is the one that was the policy, the effective
Counselor,
date.
where are we going with this? He's not an ER doctor, he was a nurse.
I'm aware of that, Judge, but he is
So
familiar.
why are you showing this to him?
I have a couple of questions about it. He's familiar with these. I'm aware of him being familiar with these.
So, help me understand.
Sure.
Ask your questions, make your record,
Okay.
and we'll see where it goes.
All right, I'm going to start with 15. This is an order set that was effective between 2010 and 2016. Do you see that?
Yes.
Okay. And under medications,
Your Honor, I
Okay.
would object as to foundation.
Sustained. He wasn't even there during that period of time.
all right, I'll try and see if I can discuss it another way, Judge.
I believe that was his
Oh, okay,
testimony.
you're right, there's another one, sorry. Okay, from 16 to 19, you were currently working there, correct?
I was employed there, yes.
Okay. And under medications of this order set, the very first thing that's written here as a guide for withdrawing terminal patients,
I would object as to foundation at this point. It doesn't-
Yeah, lay a little bit more foundation, I agree. Okay, we're both talking, my fault. He objected, speak up, go ahead and get your objection on the record.
Foundation.
Okay, I'll sustain, let's lay some foundation with
Sure.
it.
Mr. Deemer, you're aware of this order set policy, correct? Or guide, I should say.
I'm aware that doctors can use an order set for this, for pulling the tubes.
And in fact, you brought this to the attention of the prosecution, did you not?
Objection, Your Honor.
What's relevant?
My
Sustained.
last question would be relevant, Judge.
Okay,
We'll
well,
tie it
it's
together.
sustained now, tie it up then, real quick.
Okay, sure. Do you see where it says, after withdrawing of terminal patients from ventilator support, principle of double effect, as a note?
Okay, that doesn't tie it up.
Sir, are you aware of any guides or policies that address the issue of the principle of double effect?
Objection. Your Honor.
Sustained.
Can we go sidebar?
Yeah, absolutely.
Sorry.
Hi, guys. David? They definitely. Okay, you ready there? You ready, Sam? Okay, ladies and gentlemen, the objection was sustained or disregard the last question.
May I have just a moment, Judge? I want to.
You may. For some reason, that clock now has a glare on it. I can't see it as well as I did before.
Okay, do you have that? boss instructs me what to ask. Let me ask you this, Mr. Deemer. Do doctors wear the same color scrubs as nurses at Mount Carmel while you were working there?
No.
Okay. What color do nurses wear?
We wear blue.
Okay. And what color do doctors wear?
Sometimes they wear street clothes. Most of the time they wear a white coat.
Okay. Are there scrubs dark blue?
I'm not sure.
But the uniforms or scrubs that are worn are clearly distinguishable between a nurse and a doctor, correct?
Yes.
Okay. And you're currently working as a nurse where?
Objection, Your Honor. Hey, Husel.
Oh, okay.
Strike the last question then?
Yes, let me ask you this. Ask this way. I apologize. What position do you hold currently?
I am a certified registered nurse anesthetist.
Okay. And what does that entail exactly?
It entails earning my master's degree in studying anesthesia, which I did. And now I am still a nurse, but I am now licensed to administer anesthesia. And what that entails, my job duties are to assess a patient, formulate a plan for the patient's surgery, corroborate with the attending physician, the anesthesiologist, my plan and his plan, provide the anesthesia, pain medicine, all of the things necessary for them to have a safe surgery, successfully put a breathing tube in most of the time, and then most importantly, wake them up.
And this is something you've been studying for quite some time, including while you were at Mount Carmel, correct?
Yes.
I have no further questions.
Redirect?
Good afternoon, Mr. Deemer. Let's go back to where Mr. Bias started with the question about where you learned 1,000 micrograms of fentanyl was an appropriate dose. Do you recall that question?
Yes.
Okay. And he referred you to a prior sworn statement at a previous hearing?
Yes.
Okay. And do you recall the scope of where you said you learned that in that previous hearing? The scope of where this was an established practice?
I'm not sure I understand. I'm sorry.
He's asking you, when you answered that question earlier in the deposition,
Yes.
what experiences was that based upon?
Oh,
As your nurse or as your new title?
No, I wasn't
No?
asking that, no.
Okay, I'm sorry.
Yeah, this is all about back in 2017 when this is going
Okay,
on.
go ahead and then ask the question again.
All right. Was this a hospital-wide thing, or was this the unit, meaning the Mount Carmel ICU at nighttime you were referring to, where this was an established practice?
it was, I only know the ICU, so I was speaking to the ICU.
Okay. So this was the established practice of the ICU at night, because that's the only thing you ever worked, right?
Yeah, yes.
Okay. And that's where you learned 1,000 mics was okay.
Yes.
And this would have been in 2016, 2017 when you started.
Yes.
And you know when Dr. Husel started.
Do I know when he started?
Right.
I think the previous year, 2015.
Okay. We heard testimony 2013. Does that sound right based on your prior relationship?
Sustain, it's outside the scope.
Okay. But who's teaching the nurses that work the nighttime ICU?
Objection. Calls for speculation.
Okay. Rephrase the question.
Who is teaching the nurses based on your observations? Who's the teaching person there?
Objection.
Finish the question.
Who's the teaching person there on the nighttime ICU during your tenure there?
Okay. I'll permit the overruled. Can you answer?
It's many people.
Who's the main one?
I can't answer that.
Objection, Judge.
Well, if you can't answer it, I think that's the answer. Did you see Dr. Husel readily teaching everybody? Was that your testimony?
Yes.
Nurses?
Yes.
The people that stock the shelves?
Techs, yes.
Techs, right?
Yes.
And were there any other doctors on shift with him at that when he worked?
Yes.
I mean, in the ICU.
Oh, no.
All right. Actively dying equals an emergency. Do you remember that line of questioning?
I do.
And who trained you in that?
I'm not sure I've ever been trained. I don't think anybody ever has specifically said if somebody's actively dying, that's an emergency. I think that is my recognition of those three emergencies was my independent assessment of the situation.
Okay. You talked about your interaction with the Allen family, or Mr. Allen's family.
I did.
Do you recall the family approaching you and asking you, can we wait 20 minutes until midnight because that's his birthday that night?
Not that I remember.
Based on your review of the medical records, would there have been an issue of waiting 20 minutes so he could have turned 81?
Objection, Judge.
Can you answer it?
Can you just can you tell me again? I forget what you asked.
Based on your review and understanding of the medical records in 2018,
Yeah.
we've gone through them extensively, you've testified about a lot of details on them.
Yes.
Would there have been an issue of waiting 20 minutes to do the palliative extubation and the administration of those medications?
I'm not sure. Things change in the ICU.
Can you describe the person, looking back in your mind, who you say approached you about the withdrawal of life-sustaining care?
I don't remember.
You don't remember anything? Gender, age, looks,
No.
in any way?
I only remember that interaction based off of my charting, and that is when a family,
That's not mine. Go ahead, I'm sorry. You don't remember?
No, I don't remember if it was a man or a woman.
All right. Regarding Mr. Millett, remember the questions on cross about the toe being amputated and his bypass surgery, the vascular bypass surgery done on his leg?
Yes.
That was not during this hospitalization, was it?
That was correct. That's correct.
That was from a previous hospitalization back in November, which is not too distant in the past, but a week or two before.
That's correct.
Right. And it was a question to you about the 5 cardiac arrests, and then it was changed to 4 cardiac arrests. Do you know actually how many times he coded in the ER?
Numerous.
Okay. You don't know if it was 3, 4, 5?
I can't, the records are blurring together a little bit at this point.
Okay. And at the point that you're seeing Mr. Millett that night, would you have scoured those records to see those things and to take that into account in the dosing of Dr. Husel?
How many times he coded?
Mm-hmm.
That would have been something I had in the back of my mind. Typically for me, in my practice, 1 code is enough with the with the person doing CPR to break ribs. So anything after 1 kind of blurs together for me.
And let's be fair, your practice is the doctor gives you a prescription and you fill that prescription, right?
Objection.
I'll permit it. It's transitional.
He gives an order, and I satisfy that order if appropriate.
Okay. So you are not the prescribing authority,
I have no prescriptive authority.
and you still don't have prescriptive authority.
I do now in my current role.
Okay, I meant throughout your course I meant when you're seeing Mr. Millett or Mr. Allen, et cetera.
Correct. I would need an order.
So are you the one making these decisions about the dose, the type, and the timing, the way this medicine is going to be delivered, et cetera, during this?
I'm not the person who, signs off, but it is a care team directed decision.
And as you stated, as a nurse, as part of that care team, you have the ability to, in your words, clarify with the prescribing doctor.
And pharmacists and other nurses should you need to.
And in these cases, you clarified each time these orders with Dr. Husel.
All 3 times.
And in 2 of those times, you clarified these orders with pharmacy, or at least you recall seeing pharmacy the first time, Greg White,
Yeah. Yes.
and you do recall a conversation with Taylor Schroyer.
Yes.
All right. Did you testify at a previous hearing that in fact it was your understanding Greg White had authorized prior to administration of those medications on Mr. Millett?
I'm not sure.
You don't recall testifying to that?
I recall having depositions, but I don't recall that specific statement.
Do you recall testifying then that you later found out that that was not accurate, that Dr. Greg White had not authorized?
Objection.
Do you remember having that during the testimony?
Are you talking about learning after that he found, or learning after the fact that he didn't verify that, or was that what you're asking me?
Yes.
I said that somewhere, yeah.
You talk about how quickly vasopressors act and how quickly within 30 seconds to 1 minute they stop acting, right?
Well, they begin to decline in their action.
Is it your testimony, did you mean to say on cross-examination that it was the care of Dr. Magin that caused Mr. Allen to go back into the ICU? Is that what you believe the medical records show, or the lack of care of Dr. Magin?
I can't specifically say it's Dr. Mangin's fault, but I came from an environment where if I needed a doctor, he was readily available. So was Dr. Hagras. So when I hear about a patient who's rapidly declining and there's orders or there's progress notes that say they can't get a hold of them, I think a delay in care could have led to some harm there.
That would be speculation on your part regarding the care Dr. Magin gave him?
Sure, or didn't give him, yeah, sure.
You were not present for any of that?
I was not there, no.
Okay. However, it did reference the family and how involved they were and how insistent they were about the care Mr. Allen was receiving.
In terms of the son wanting to speak, or that family member wanting to speak with him, yeah, that's correct, that was written.
And is it your memory that the entire Allen family and everyone that was there was that persistent about the care Mr. Allen received?
Objection. Leading.
I'll permit it.
I wasn't in the room for that. I don't know.
You don't recall the Allen family being there? As is evident by the note regarding Dr. Magin.
Well, and they were in the room, obviously, and had to be updated, which led to them coming out and finding me, voicing their desire to withdraw care.
All right. And that's your memory of how it happened, but you can't tell this jury about anything about that person looking back in your mind's eye.
No, I just can recall being approached by a family member.
All right, let's talk about the family member on Mr. Timmons.
Yes.
You know his name, you remember him, Lynn, right?
Yes.
All right. Do you recall calling Lynn multiple times during the night after he had gone home? and asking him to change his brother's status to DNR-CC?
I recall calling him, but I never would have said, hey, you need to come in here and change this code status. That would not be something I said.
Do you remember calling him multiple times?
I remember calling him, yes.
And once again, multiple times, like you remember calling him, was it once, twice, three?
Oh, I'm not sure of the number.
Do you recall that Mr. Timmons had a son that was driving up from North Carolina?
No.
Objection, Judge. It's not Mr. Timmons. Mr. Hayes.
It's not? Oh, sorry. Oh, well, there you go. Sorry. Please, if I could, I will withdraw that question.
Withdraw the question, ask
My
a new
mistake.
one.
I
Okay.
apologize. You were asked questions about respiratory depression. You recall that?
Yes.
And you recall testifying on cross-examination regarding your knowledge of respiratory depression at the time of these palliative withdrawals?
Yeah, I answered that.
Okay. So you're aware of the phenomenon, correct?
What phenomenon?
Respiratory depression.
Yes,
You understand what it is medically.
I believe so.
That was your testimony. But you were not aware of the package inserts on midazolam and/or fentanyl regarding the known effects of respiratory depression.
Objection. Leading.
Okay, he's asked, I'll permit the question, but I haven't heard it all, so finish up your question and I'll rule.
All right. Were you aware of, but you were unaware, or were you aware of the known respiratory depression effects of midazolam and fentanyl individually?
Okay, sustained.
Were you aware of respiratory depression being a side effect of fentanyl at the time?
Yes.
Were you aware of respiratory depression being a side effect of midazolam at the time?
Yes.
Were you aware of the synergistic effect of those two drugs when given at the same time?
Objection.
As to his awareness, I'll permit it.
At
Fear.
that time.
At that time.
Yeah, that's what he said.
It was just that, it was a theoretical concept that was briefly covered in training.
Okay. And what training are you talking about? Was this training that you received during school or training you received from Dr. Husel?
My answer there was referring to my clinical, so that would have been my education, my school.
So did Dr. Husel ever talk to you about the synergistic effects of fentanyl and midazolam being used together causing respiratory depression?
I don't think so.
Regarding the death of Mr. Timmons, the two doses, the 1,000 micrograms and the, how much midazolam did he get?
The first time 10,
Okay. Those are given at what time did the MAR indicate?
I wouldn't be comfortable saying I could see it, and that would help me.
Was it 3 p.m.? Does that help? 3 a.m., excuse me? And then I can get them out again. Do you recall that being?
Roughly, approximately,
All right.
it was after midnight.
And then, do you recall testifying about the 5 minutes?
Yes.
Later? The time frame we're talking about was within 5 minutes. You say he came running out and told you he's still in pain?
Yes, I remember that.
All right. Do you recall Mr. Baez asking you about the amount of fentanyl he had received during surgery and during his hospital stay previous to the palliative extubation?
Yes.
Had you added that up yet in your mind
Have I,
at the time of the palliative extubation?
I did not sit there and add it, but there was a running total on the bottom that allowed you to see just what he got in the drips. But that was not something, I didn't include other breakthrough medications, OR dosing, things like that. I knew, though, that bag of fentanyl had been refilled multiple times, which left sort of a running total at the bottom.
All right. But once again, these are not your decisions regarding the amount and type of drugs. These are Dr. Husel's decisions, correct?
He's the prescriptive power.
And you said one of the things that was in your mind was that because of what you knew that he was had been at least reported in the medical records, an opioid user on the street, that he had an opioid tolerance, right?
An opioid tolerance.
So 1,000 mics, 10 milligrams. What about Mr. Millett, this 74-year-old guy that came in? Was he a known opioid user out on the street?
To my knowledge, no.
And what did he get?
1,000 and I think that was 4.
And Mr. Allen, the 81-year-old man, was he a known opioid user out there on the street?
He wasn't using street drugs, no.
All right. And what did he get?
1,000 and I think that was 6. And then there was 2 of hydromorphone.
Okay. And in fact, Mr. Millett, when he came in, what medication had he received prior at all during his hospital stay there?
I think you said Tylenol.
Well, is that what's in the medical records? You've had a chance to review them?
Yeah, I had a chance to review them for Mr. Millett. I'm just thinking, I'm sorry. Yeah, yes, that's what I remember.
All right. So you would agree, or would you agree, that the guy with the known drug tolerance from the street who had surgery and everything else got, at least initially, the same as Mr. Millett and Mr. Allen, as far as fentanyl goes?
Objection.
It's patient specific.
So these 3 patient-specific doses for the fentanyl were 1,000 micrograms?
That's what we settled on.
The medical records don't always tell the whole picture. Remember that line of questioning with with defense counsel?
Yes.
All right. You do have time to sit down after the fact and chart these things out, right?
After the morgue care and taking the patients to the morgue and things, yes.
Okay. So you would have had time, had you seen the pain and things that you've testified to that aren't charted, you would have had time to go back and put those things in the medical records at some point after the fact.
There was time to do that, but I didn't.
So we have Dr. Husel at bedside, we have you at bedside, we also have the family members at bedside, right?
I agree.
And you had to go back and review this, Danny Millett, James Allen, and Mr. Timmons, right?
I reviewed them.
Because these were one of thousands of patients that you cared for during your time at Mount Carmel, right?
That's correct. I cared for a lot of patients.
So those families that were there,
Objection.
I haven't heard the question yet, but go ahead and give me the question.
the families that were there at bedside for their loved ones, right? Based on your training and experience, is what they observed in your mind valid?
Objection. Calls for speculation.
We got a hand up. You need a break? Okay, we'll get you here in about 2 seconds here.
This is my last one.
That's your last question?
Is that my last question?
For this witness.
For this witness, yeah.
Okay.
I'm sorry, I don't know, let me go through stuff. Yeah, that's it.
Rephrase the question because technically he's correct.
Okay. You saw family members for Timmons at bedside.
Yes,
You saw family members for Allen at bedside.
yes,
And you saw family members for Millett at bedside.
yes,
And they could see and observe, based on what you saw, everything that was going on too, correct?
yes.
Thank you, I have nothing further.
Okay, you can step down. We'll take our break. A little early, but I'll give it to you. Looks like you could use it. David, call him up.
All rise.
Remember the admonition, 15 minutes, guys. We'll get started back 10 till. I think from looking at that clock, I like it now as a reflection. Have a great break, guys.
Thank you.